Good afternoon. This is Dr. Bill White again, and I'm with the American Orthodontic Society, and I'd like to talk with you some today about a mild Class 3 correction, and you can do just simple, easy Class 3 corrections that you check the parents and the genetics on the person before you start, and if there's no really raunchy Class 3s in the family or in the immediate family, then you can probably do this okay. And we remove the lower wisdom teeth later on during this case, but leave the upper wisdom teeth, and it works out quite good to correct the Class 3 and leave the upper wisdom teeth where they're pushing forward on the upper teeth, and you take away the pressure from the lower teeth, and this allows us to stay like this. We've had pretty good success in doing that. So you can watch this case, and if you have a same situation, you might try this. So here we go with this young lady. Now we've got a lot of fluorosis in the case, and her teeth are stained terribly, but she can deal with that after she's grown, and gets up further after they mature. Okay, here is a sweet little girl, and she's just nice as she can be, and we watch her for several years here now as she develops. So this is her, and it is her facial structures normal and good, and everything is okay, and she just got a mild Class 3 problem with the upper teeth trying to get in. Now, upper teeth are out over the front in the models, and there's no crossbite here that we see, but there's a lot of space in the upper teeth, and we realize they're having a tough time coming in and staying where they are. So we'll show you what we did here. Now she is missing an upper deciduous 3, like this tooth is gone over here, so everything is kind of shifted over to the, looks like the right side of the mouth here, and so we have to kind of compensate for that as we go through. Here we put we go in pretty early, and we put a kind of a spring in this arch wire. We're compressing it so the arch wire itself is pushing out, and then we put some spring over here, but not as much as we put on this side, so that we can push this more or less to the center. See, your midline is off quite a bit right in here. Now it's pretty hard sticking brackets to these teeth that have had so much fluoride on them, but yet we get a cavity in one of the lateral teeth, looks like on the side of it. Okay, this is centering back up pretty good. We'll have to open this gap, which is already open a good bit more than this one right here, so we're pushing everything in that direction and coming off of with an arch wire that's shoving forward with those loops on it. So I'm then trying to explain exactly what we do in doing this. Now we started this quite young. This is 1911 of 86, so it's nearly 87, but we started back in 86. Now this is we stretch this spring out on this side. You see, we caught it and just pulled the spring apart and gave it more pressure over here than we had on the other side. That's one way you can take these springs and just spread them out while they're on the arch wire and increase their pushing power, to line that up. So that's another little trick. If you haven't learned how to do that, you can just part the spring and spread part in several different areas, and you can lengthen. You take an opening spring and just make it where it's about that long. Well, it's not that long, but it's a lot longer than it was, and it'll have more force pushing back on it than it did before by just widening little gaps in the spring. That's another trick. If you haven't done, you might be interested in that. And this was the other side. So here we're trying to get this back. Well, we've shortened this side. We're lengthening this, trying to move these teeth over. I was mistaken on the other part. We're pushing back there on that. But you can widen or lengthen a spring like that. But we've put a lot more pressure in here, and so we're bringing these teeth over. So this will reduce. I widened it apparently just to fill the gap right there. So we're bringing that back to the center. Down on the bottom, everything's lined up pretty good, but it's out in front of it. And here we're just barely in here, you see, and this has the gaps in this side. So we're trying to bring the upper out here pretty early on. Now here is the first panorex. You can see the cuspid teeth up here. There's a cuspid coming, trying to get into this spot between the lateral and the deciduous tooth right in here. And here is this cuspid coming down, and this is a bicuspid. So we got a tight spot in there trying to bring this cuspid in, and this one will have a little better chance. And so we're going to come in here early and band these 6-year molars, and we'll run some brackets on this and bracket these teeth right in here and try to group them together so you can watch that happen. And here we've banded the centrals and pull them together. We should put some tip in those, and it would bring these roots together right here. So this is the second panorex right here, and we want to get these laterals over and catch their roots and bring them up in that direction. Excuse me. And here is the third panorex, and we have gathered these together, but we haven't put this tip like we've shown you before. You can make these roots kind of go like that, and they'll be better and wider, and the cuspid can come in here better. However, the developing root is right by the crown of this tooth. That's why I like to taper those roots together till you get the cuspid down in there, and then you can leave them alone and they'll spread back out again. We didn't do that very good at that point. But now here are the lower 12-year molars. You see them coming in, and we've got wisdom teeth in both areas, on the bottom and the upper 12-year molars. And this one's running behind, and this is an upper wisdom tooth developing here. You can't see much of it. This is a 12-year molar. See, the child is 7 years and 10 months, look like here at this point. So you have to, in order to do this, you have to watch and do things along as the child develops. It's ridiculous to say leave them alone till they're 12 or 14 before you mess with them. That may work in some respects, but you grow out of position and everything else by doing that. So you need to do little bits of orthodontics along the way, and some kind of a preventive and interceptive orthodontics that you do. And to me, a pediatric dentist, it shouldn't be any question that they would do orthodontics. That just bothers me, that they feel like they shouldn't do it. Now, the only way they can do it is 2 or 3 pediatric dentists would hire one orthodontist to come and work in their office, and he'd have to come around and do these little things. But they do not learn this in school. They have to teach them themselves if any of them know it. So we think that you should start learning interceptive and preventive orthodontics as a pediatric dentist, or any dentist that's going to be working on children ought to know preventive and interceptive orthodontics. I've just harped on that till I know you're tired of hearing it, but it's not taking place properly yet. So anyway, here we go again. She's 7 and 10 months, and this video comes in. She's 8 and 1 month old now, and we've got these together. We took the centrals off some reason or another, and we had some other bands back here jumping over, and we've got these teeth pushed together, and so the cuspids are coming on down in there. This one really ought to put the tip in there and have this root coming up that way. I didn't do as good as I could have done here in this area. So anyway, let's go on to the next pantograph. Let's see, she's 8 and 1 month old at this point. All right, here's number 5 panorex, and the child is 9 and 3 months old at this point, and this cuspid has made it past right here, coming on down in this area. Here is the bicuspid, and here's the second bi that's coming under. It's got more space than it has to have, and that's going to help out a little bit up here. But you see, we've got a class 3 molar forming in here quite a ways before this molar. So over here it's just a super class 1 on this side, and we really want to bring this out further, and so we're thinking about eliminating these wisdom teeth. We'll watch it. Now you look at the genetics of the family. If you got somebody that's just really way out like this, just hold off. You may have a worse problem, and you may have to come back and do the 6-year molars, which we are not planning to do at this point. So she has no genetics of real bad class 3s. There's a lot takes into the consideration. Here she's 9 and 3 months old, and this is a girl, and she'll only grow till about 12 and a half to 14, and very rarely do they ever grow past that any. I've had one case like that. All right, this is 1988, and things looking good here, and we've taken things off and had a retainer in her mouth, and we'll show that. And now we've decided we are going to recommend they remove these wisdom teeth. Now that takes a lot of push from this side off and leave all of this up here. And these are going to stay and that's going to go. And that gives you a pressure on this part and it'll work out pretty good. So if you haven't tried this or watched this in preventive and interceptive orthodontics, she's 9 and 6 months old at this time. And now here she's 10 and 5 months old. Excuse me. And we're getting pretty close in here. We're going to get these teeth in. There's no problem about that. But we would like to get this pushed further. Now this 12-year molar's hung up here. It's working down here and it's pushing on this. We've got to get this across. So you can take a separator and go in here and spread this apart and leave it for a week or so and then take it out and the tooth will go on down past that. Similar thing over here. It's hung up on the band. We need to get these teeth in there so that they support this forward push of the upper, and we're going to take away the push on the bottom down here. So this will be gone. So this is the thinking behind this type of case. So she's 10 years and 5 months old at this point. Okay, here she is 11 and 6 months old, and we got the second molars in, okay, and they're putting some pressure on this, so we can put spring and get that. We still have not taken these out, so anyway, we're planning to do that anyway. Now, here we are. This is 12 of 91, and she's 12 and 6 months old. Now, I will guarantee you, if you had left this case alone, you wouldn't be anywhere close to this. I mean, it's almost ideal and everything. We centered it back up. She's got a good class 1 relation in the molars. Everything's lined up and looks darn good now, and we'll have some pressure from this wisdom tooth as it comes in. You may not be able to keep it, but let it come in as far as it'll go and push as much as it'll go and leave it in there, and that'll hold those teeth forward. And we've closed up on the bottom. We've got this cavity which normally doesn't happen on these fluorosis. These teeth that are fluorosis have so much fluoride you can't. They're really discolored. So let's see. Now here's where we're going to go back down the treatment and work up. We put a retainer in there to hold that for a while we were working on it. Then we got the bottom teeth coming in, and we'll go through this pretty quick. This discoloration is bad. I mean, that's a lot of fluoride in this, and it's hard to stick a bracket to this, but you can. You gotta etch it good, and it's hard to even etch teeth like that with that much. And here is the midline on the bottom and the top, and we're gonna start out. This is 88 and 12 of 88, and here's a cute little girl. I mean, she's just pretty. This is 1988, and here she's a little older. This is 90. This is 89, 11 of 89, and now we're into the braces and going with it. We're putting a lot of spring pressure over here, and we've taken everything away from this side, so we're pushing them to the center, right here, the center of these teeth. You notice even on these children, we put the brackets on the lower anterior teeth, this low is we can get them and keep them, and they don't see them, they don't bother them as much. Now this is that's 89. Sorry about that one. Okay, here's level of 89, and we've got a big space, you know. We could see that on the x-ray. So we want to increase this gap and reduce this one over here, apparently. And that's level of 89. Now, down on the bottom, we've got space down here, but we'll be closing all of this space. Let me go back here. Now, this discoloration, you notice our brackets are, of course, down below it, but there's all the teeth are this chalky white color, and that's bad. And we're going to finish her out. This is 1991 now, and we're going to finish it. And we've got the teeth centered out. And here's 91, and you see her grow up. Still a pretty young lady, and this is her teeth after 1991, and they're lined up, and we'll put a retainer on that. We're going to let these teeth erupt together. They're not as good in here as it is on this side, but we'll leave this, and then they'll work that problem out, and the teeth will have this support from the wisdom teeth up here, and we've taken it away down here, so we will think that this is not going to grow out from under us, because we've looked at the parents and other people in the family, and she's 12, and no, this is not her age. Let me see. At this point, I don't know what her age is here, but you see this cavity she had in this lateral. That's unusual with as much flouride as you've got in the teeth. And this is her in 91. Got a good facial structure and everything, and she may be able to do something with these teeth as she matures. Do something to take away this discoloration, but you can't bleach them out, or you can't do it. It's a hard fact. And a lot of these people that grow up in West Texas, where they have many, many times more fluoride than you'd put in them. And here's her from the straight, looking straight at the facial structure, and that's her smile. And here she was when we started. So this is something that you might want to learn about preventive and interceptive orthodontics. And this is some things that pediatric dentist or any dentist that's working on children should learn. Some preventive and interceptive orthodontics that you can do. And I really believe that. And I want to encourage the pediatric departments to start teaching orthodontics. They don't have to do these raunchy adult cases. Leave that to the orthodontists. They don't want to do it either. But we ought to be doing these tough orthodontic cases. So I'm going to hush and say goodbye. And thank you for watching. And I'd love for you to subscribe to our program. So we close out here and say goodbye. I hope you got something out of this. Thank you now.